Welcome everyone. My name is Andres Diaz, also known as the Able Disable, and in today's show we are going to be talking about, as you can see right there, Chinese cup therapy. And I'm going to show you different ways throughout a whole bunch of different programs how I use Chinese cup therapies. But today I'm going to show you the beginning, how I would use it at first, and then we'll make another video, more advanced, and different ways to use it. But the focus on today's show is using Chinese cup therapy to force nutrients to get blood through those muscles to that area that's been injured. There's no movement. Um, today is gonna be showing you how to loosen up tight muscles, how to create blood flow through these muscles, because that's a very important thing with the cups. It brings it rips tissue. I mean, it does so many things. And I'm going to be explaining what I'm doing as we go. Today is going to be the first time, the first Chinese cup therapy, and it's going to be, like I say, I'm gonna show you through other videos, other things that you would do with this, or other ways to work it on you. But today's focus is creating mobility in an area that's paralyzed. We want to create mobility by literally with a cup suctioning that area and just running it up and down, right? We're going to be tearing tissue. We're gonna be separating skin fascia, okay? We're going to be tearing up scar tissue. We're going to be loosening up all those muscles that are there in the back that are completely stiff because there's no movement because of, we've been paralyzed. Um, because of my spinal fusion, there's no movement in that area. So this is how I get nutrients, how I get vitamins, how I get blood moving, stimulating it. It helps. It has so many benefits. Every tool works great if you use it at the right time in the right manner. You don't want to use a hammer to brush your teeth, but you definitely want to use a hammer to bang some nails in, right? Okay, so same thing here. Chinese cup, Chinese cups is not going to solve everything, okay? But it's going to be a tool that you're going to be able to use to be able to help yourself to get better. So when I use the cups at the beginning, I like to use a little bit of a massager to loosen up the area. So I'm going to be showing you that. I'm going to be showing you everything that I do as a beginner. And then, like I say, later on, we're going to keep making more Chinese cup videos. We're going to keep making more tense unit videos. But every video has a purpose. And we're going to start from the beginning. So, like, the first videos that I show you, start with that. Because if you're going to start with the next Chinese cup therapy video that I do is going to be more advanced, you're not going to get the benefit. You're going to get benefits from that, but you're not going to get the benefits that you will get if you will start from the first Chinese cup therapy, okay? Because this is what we're going to be doing here. We're going to just showing like the tense unit. We're not done with that. I just barely showed you how to use the tense unit in an area that is paralyzed, but there's so much more that you can do with the tense unit. I'm going to show you how to completely send the signal from the spinal cord all the way to those limbs and area with the tense unit. Okay, so I mean we're just at the beginning. So like I say, try to watch all these videos in order. I mean the first one is just me explaining what's going on. The second one, there's actually some exercises, some stretches, and some movements. Do those. Then after that, go to the stimulating one, number three. I think it's number three, where we use the tense unit. Go ahead and use that. So what I'm trying to say is, like, through a whole week, okay, through a whole week, Monday, Tuesday, Wednesday, Thursday, Friday. So if I was you guys, I will start with the mobility video, and that will be my Monday, okay, and then on Tuesday you go to the tense unit video, and then you will do the tense unit, and then on Wednesday you will go to the Chinese cup video, and then we'll do that, and then I'm going to be putting out the videos in order that you should be doing these therapies, okay? I'm not just going to show you every single thing that you can do with the tense unit because people get confused. I want to show you from beginning to advance. Like if you do all these things together, they'll work in conjunction to make you feel better. Like I say, if you're gonna start with the fourth, fifth Chinese cup therapy that we're gonna be doing in the future, and because it's the last one, and you think that if you just do the stuff in the last video, then you're going to get all the results. No, you're not. You have to do everything that I'm showing you to get to where I am. Okay, so everyone just wants to go straight to, you know, gratification, but no, you gotta put in the work to get the gratification. Okay, so please bear with me here. And like I say, those other videos, learn the stuff and do it. Like I'm already that right there, those other two videos that I giving you stuff to do, that's already 2 days of physical therapy. If you do those two things every 3 days, boom, 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 boom. I mean, 3 days a week. Do that 3 days a week. Boom, boom, boom. Stretch, tense unit, Chinese cup therapy. Those three things that I'm going to show you. That's 3 days of therapy that you can do yourself. Okay. Eventually, we're going to fill up the whole week. Okay. By the time that we get to video number 8, or because the first one wasn't much of anything other than verbally explaining what I was trying to do here and accomplish. But if you start from video number 2, so you're gonna have 2, 3, 4, 5, 6, 7, 8, and those 8 videos are going to be able for you. It's gonna allow you to be able to set up 7-day week of physical therapy. Okay, so that's the point. Like all these things, like don't just do them one day and whatever. You want to do them every day of the week. So far I've given you 2 days of the week of the therapy. And this is just the beginning part. Later on, when you guys understand what's going on, when you're getting benefits, when you're getting benefits of what we're doing, then you work with that. You know what I'm saying? So if I'm showing you how to stimulate the nerve, right? A nerve, and that nerve's actually firing, then we're going to get that nerve to fire to the next down the line so we can get wake up, wake up, wake up, wake up. Trust me, do the research, Google it. There's so many other people that have done this. I'm not bringing you anything new here that I just discovered that miraculously I created this. No, I did a lot of research and then I put everything to work that I saw, and I'm sticking with the stuff that I saw had benefits. Right now, if you go out there and you ask doctors and you tell them about this and that, I don't even tell my doctor what I'm doing, okay? Because they don't know, and they're not gonna co-sign. They're not gonna be like, yeah, that's a good idea, go do that. They won't be reliable. They'll tell you, oh, I don't know about that, but you should try it, or it might just tell you something negative. Like at the beginning, all the doctors were like, oh, don't do exercises. Like they freak out when when they figure it out that I'm using tense units, that I'm using Chinese cup therapy, that I'm doing all this thing on myself, that I'm tearing up scar tissue, I'm doing all this. They all get freaked out and tell me, please stop doing that, don't exercise, don't do this, you're gonna hurt yourself. And it's the opposite. If I don't do anything, I get hurt. By me doing everything that I've been doing, I've been able to wake up everything else. I have only had one physical therapist that has helped me in 17 years of this, and I didn't meet her until like the end, until the last 5 years at the end. So for 12 years, I did my own stuff from ground zero, from like not being able to walk and being paralyzed and being like, I want to get out of here. All right, enough of that. So what I'm trying to say here is watch all the shows. Watch show number 2. Take the exercises and the movements and everything that I show you in there and make that your Monday. Okay? Then go to show number 2, and that's the tense unit. Make that your Tuesday. Okay? So right there, we already have 2 days of therapies. Okay? And we're gonna fill up the whole week. Okay? So today's show, Chinese cup therapy, I'm gonna be showing you how I do it, and I'm gonna be explaining as I'm doing it and why I'm doing it. I'm not just gonna start putting cups and be like, oh yeah, this is magical, oh, it's releasing toxins. By the way, if anybody brings up Chinese cup therapy to you and they start talking about toxin release, run. Okay, toxin release, out of here. Anytime that anyone starts talking about you toxin releasing, get out of here. Okay, that's just or this is another great quote. Oh, it works on a cellular level. Cellular level. Everything works on a cellular level. Anyway, guys, be careful out there who you listen to, and everything that I'm telling you, everything that I say, Google it. Don't just Google it. Read books. Challenge it. Everything that I'm telling you right now, don't just take it in. Challenge it. You know why? I ask you and invite you to challenge what I'm saying, because once you see for yourself that the stuff that I'm telling you is true, then that's when you're gonna believe it and certify it and be like, okay, I believe what this guy is saying because I looked into it. And the people that have done the same things that this man has done actually have had um, some type of benefit or a positive outcome. Okay, once again, the only reason I've been successful with all the little therapies that I do has to do with one thing only. One thing only. Surgery that was done to me was a successful surgery. My body accepted the implant. The doctors did a great job of what they do, you know, and I got very lucky. And God is in my side. I mean, those things I can't tell you anymore. I mean, if it wasn't because of those four things, everything that I'm doing here wouldn't work. Okay, so I'm very, very, very lucky, and I thank you guys, and I encourage you to not give up and keep working hard and everything. Pro gamer, gamer, shout out to you, my brother. Don't give up. You are a soldier. You're a warrior. Okay, and I know you're gonna reach your goals pretty soon, man. Just don't give up, and I salute you, my friend. Salute you, because I know what you're going through is rough. Okay, super tough. Believe me when I tell you, my brother. I've been there. So whatever you need, man. If I can help you, I got your back, bro. And shout out for you, because you're always asking questions. You're always interested, and I can tell you're on this. You got that fire. You want to. So thank you so much, man. I appreciate your questions. I appreciate you watching. Thank you, pro gamer. Salute to you, my brother. You're a real one. Okay, enough of that. Now we're gonna get to this Chinese cups. Okay, we're gonna show you what I did, and once again, I'm gonna lay on that table, and this is me. I'm pretending. This is think of me as in like I couldn't walk. Okay, because this is how pretty much all this started. Okay, so I'm gonna just lay down on my back, and I'm gonna be just working on myself. Okay, and that's what I did, and that's why I'm showing you. That's why I don't have somebody. I can pay somebody to come here and put those things on my back and do all this stuff. But what's the point? You need to see the struggle. You need to see what I did. You need to see, oh, I put it wrong. Okay, this is how I do it. So you gotta see how you do it yourself. Okay, because if you know how to do it yourself, you can have somebody else do it, and then you can supervise and be like, oh, they're doing it wrong, they're doing this, they're doing that. So first learn by yourself. Watch me struggle. And again, this is a live show. I don't want to edit anything here. Okay, this is real, this is live. If there's a blooper, if there's something, bear with me. If it takes me a little longer, if something falls or something, I have to dig for something. This is a live show. Another thing, please follow me at twitchtv.com. twitchtv.com, the able disable. Why? I tell you why. Because if you follow me there when I'm doing my live stream, I want to be able to answer your questions and show you stuff in real time. So my goal with the live stream is to go in there, and some days I will show you what I do, my routine, what I will just take you through all the steps to all the stuff that I'm doing now to therapies, exercises, and all the stuff. But I want to definitely take like a day or two where I dedicate that day to somebody in the chat where they're going to tell me their issue, their problem. So somebody's going to say, I have a T6, T7 injury, okay? So I'm going to show you what I would do. So, and I'm talking about from zero, from like grabbing the computer and going, we're going to research together. I'm going to show you how to look up stuff, what to look for, and it's very easy. I'm not discovering anything new, but some people don't know how to look into stuff. So I'm going to show you exactly what things to look for. So I'm going to pretend I have your injury, whatever it might be, and we're going to treat it live. And not treat it live. I'm going to show you what I would do if I had that injury. Okay, I'm not a doctor. I do have certifications and diplomas. Blah, 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 blah. Who cares about that? Okay. Blah. So here's the point. Here's the point. Please follow me, twitchtv.com. Go into Twitch TV, find my little site, and there's gonna be a little heart, and just follow me. You don't subscribe, don't do nothing. Follow me. It's free. Just follow me. That way, when I go live, you're gonna get a little alert in your phone. Then it's gonna show you the able disable is live right now at this moment. So you will come in, and then we'll be able to talk about your injury. I can give you ideas. I can learn. I mean, we'll go through this together. I will show you what I would do if I had your injury, how I would do the research, what exercises I'm gonna show you. Like, we're gonna look into exercises, we're gonna look into therapies, like all this stuff. Okay, so the able disable at twitchtv.com. Okay, find me there, follow me, hit the alert thing, so that way we can work together. Okay, we can give each other ideas, and hey, if somebody out there has more ideas and they kind of want to try them out, I'm not scared of trying stuff. Okay, so in the chat, you let me know, hey, I saw this and this, what do you think of that? If I know about it, I'll tell you, and if I don't know about it, we will do the research together on real time and see if it will be something that'll be worth doing, and if it is, I will do it on the air at that time if I believe in it. If the science, the research, and theory and everything's just off the rocket, we're not gonna do it. Okay, and you guys can understand why. I mean, there's so much stuff out there with false hope and stuff like that, and I don't want to waste anyone's time. So everything that I do and everything that I'm doing, that I'm showing, I show it because it worked on me. And I mean, what else can I say? The proof is that I'm walking. Okay, I couldn't walk. It took me 5 years. Okay, but here I am. Okay, to be able to completely control my body. So if I did it, you can do it. Okay, enough of that. Let's get to work over here. Okay, all this yappy. Okay, so I'm going to set up the microphone now. And like I said, bear with me. I'm gonna be doing like setting up stuff. Just watch. Just grab some popcorn or something. Just root for me, make fun of me, do whatever. Okay. Check out the gym back here, whatever. As I set stuff up. So I'm gonna tell you right now what I'm gonna do. I'm gonna set up this mic. I'm gonna set up this mic right here. I'm gonna show you guys. Show you everything I do. Okay. So bear with me. See, this is what I'm talking about. We're live here. We're setting up cameras. We're looking up for angles. Okay, so I just moved this thing here, move the ball here. I'm going to grab this mic. I'm going to shove the mic right here so I can talk to you guys through here. I'm not going to see my face anymore. Not that you want to anyway, but we're going to go in here and I'm going to be talking to you guys here, and I'm going to be showing you through this screen and through that screen right there where you're seeing the picture of the cups. That's going to be my back. So my back is going to be literally right here. I'm going to be showing you everything. So let's get started, man. Enough talking. You can sit here and just yap the whole time and, get nothing accomplished and feel like you did so much, but all you did was just... Okay. Guys, setting everything up. So got a towel here. That towel is going to be to wipe my hands. I got a little bit of cream. You can use any type of lotion you want. I don't really like to use oil, because then when I have to wash out the cups, water and oil, nah. And I don't really want to use soap. I mean, use soap, but you don't want to always use like a hard soap. You have to use like a light soap, like something that's not going to damage the plastic of the cups. So there's soaps out there that you will use for sensitive skin. That's actually what I use to clean the cups, and I'll show you guys in another video how to clean all that and the right way to do it. You want to use warm water also, not super hot, because once again you loosen up all the rubbers, all the fittings. You gotta keep them tight. So, all right. So what do you need today? What do we need right now? We need little thing of lotion, okay? So I'm gonna use that little thing of lotion. We're going to need our hose for the attachment of the Chinese cup suction. This is a very basic. You can go into Amazon and buy it for like $10. Okay, this ain't nothing fancy, nothing crazy. I'm not really gonna tell you the name of it because it's obvious once you go into Amazon, and I don't wanna give people advertisement for no reason. But all I can say is just don't buy the glass ones. The glass ones tend to break, and sometimes the cups like slip out of you, fall into the ground. They'll smash, especially if you're doing it by yourself. So just buy the plastic ones. You know, like I have this guy right here. This guy's plastic. You know, but he's good. He's legit. He's not. You know, he can fall. He's gonna last. So I would just buy this kit. Don't buy the kit with the the original kit, the real one with the fire. They use fire. You put alcohol inside here, and then you put a flame and you stick it on somebody. Don't buy that. That is for somebody who's very advanced. I would know how to use it, but I don't want to because it's too much of a pain. I want to deal with flames and stuff. You know, we're trying to fix stuff here, not be in a circus doing tricks with fire. Okay, here we go. Boom. Got my Chinese cups. So I'm gonna go for the biggest ones. Today I'm gonna be using the biggest ones because I want to cover the most areas possible. So I got the bigger ones, the second biggest ones, and then we're gonna go for the third biggest ones. Okay. The other ones, there's other smaller ones and stuff like that, and those are really cool and handy when you want to work on other small areas. But today we're gonna be using that, and this kit's pretty cool. It comes with a whole bunch of stuff. It comes with this little caps here too. Now this caps, you know, that's the only thing. This caps, you know, I'm not really sure. So supposedly this caps here are for acupuncture. You can also do acupuncture with this, apparently. So what you would do is you will grab the cup and then you will stick. You know what? I'm gonna do it. We're gonna use this. And you stick the thing like that in here, and then you see the little piece of metal here. So what they want you to do here is they're trying to have you connect all your meridian points, you know, and this is metal, so they it's kind of like what they're trying to imitate here is kind of like acupuncture. Okay, they're trying to have you connect by, it pretty much makes it like a needle, and I don't really believe in it, you know. I'm gonna tell you the truth. So these are the little things that kind of discredit Chinese cup therapy sometimes when you do this weird stuff, you know. Uh, I know this really works. This works, but you know, I don't know anything about these things, and I see they have metal. They have like a metal tip. If you can see it, it has like a metal tip, and then it has plastic. And supposedly, according to what it says, is um, you put this in a meridian point. Meridian point in your body is points where electricity will flow from, major points. So they want you to put those in certain points. So you'll be putting one cup here, one point there, and then you attach all your meridian points for a release. But you know, those are the things that I don't know about, and I'm not gonna say that they work, and I'm not gonna tell you that they don't work because I don't know about them. So we're just gonna leave those alone over there. So this is what we're gonna use today. 1, 2, 3, 4, 5, 6. I got 6 cups. So what am I gonna do today here? Let's show you a little bit. So pretend this is my spine right here. Okay, this rolled up thing, this rolled up towel, my spine. Okay, this is what I'm gonna be doing today. I'm gonna show you like this and show you why I do it. I'm gonna grab the Chinese cups and I'm gonna put them like this, just like that. Okay, so this will be my spine, and this will be the Chinese cups. So the first thing to do, we're going to imitate this on my back. Okay, now I'm gonna put those things on. I'm gonna leave them on, and we'll leave them there. I mean, you're supposed to leave them there for a while, but I'm gonna do it quick. Otherwise, this video will take forever, and you don't need to see me just laying there just putting cups on my back. But definitely gonna show you. So we'll set them all up. I will leave them there. I will tell you for how long you want to keep them on. You can keep them on for a while. Depends how much pressure you're using, um, and what you're trying to accomplish here. So this is pretty much what I'm gonna be setting up on my back. That's gonna be my spinal cord. This is gonna be my injury right here. This towel is my scar. I'm gonna be setting up the cups like this. Okay, that's the first thing we're gonna do. What am I doing here? Why am I doing here? And why am I doing this? I wanna all these muscles around my injury, here, 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 all the nerves. Everything's just so tight, and and any movement will create a spasm. Okay, when you have like tight atrophy muscles or areas because there's no movement, I have a spinal cord fusion in my lumbar, which will be right here. So L3 and L4 have no mobility. So this is how I get mobility on it, and how I force blood into those areas and stuff like that. And that's how I get rid of. Wait, hold on. What do we say? Stay away from people that talk about toxins. And that's how I get rid of my toxins. Just kidding. I just wanted to joke about that. Okay, forget about toxins. Toxins. It's such a nonsense. Anyway, so we're gonna be using these guys like this, right? So that's gonna be the first thing. I'm gonna set them up like that, and they're gonna be lifting. So once I put them in that area is all smashed down. There's no mobility, so all the layers of skin and fascia are just stuck together. There's probably pockets of just fluid just been sitting there for like a while because there's no mobility. There's scar tissue in there. Everything's just getting stuck, atrophy, and that's what these guys come in. These guys come in and they just go in there, they suction, they create pressure, and you start. First, you put them on like that. So that will be the first thing we'll do. We're going to put them on like that. Leave them there for a while. You can put them on there for like 10, 15 minutes, okay? Then you're going to release them. And then we're going to go to one, okay? I'm going to take this one guy. We're going to put it, actually, we're going to go to one after that. And then this is the two things. So I'm going to be showing you how to do two things with the Chinese cups today. So the first one was to create flow, to release that stress, that pressure, that stiffness. When you put the Chinese cups and it's pulling on that, it actually like stretches out the muscle. So by the time you take the Chinese cups off, all this area around here and around here is going to feel with less pressure, okay? And it's going to bring fluid, it's going to bring blood. It gets a little bit of inflammation, but that's good. It's a message of healing, okay? So it'll be inflamed just for a little bit, but don't be afraid of that, You're going to feel release, all this. That's what we want to do. The whole goal of what we're doing here today with the Chinese cups is we want to release all the muscles that are around your injury, that are completely atrophied and stuck together, that are creating spasms and that are impeding you from mobility. And also, by doing this, there's gonna be only so much stuff is gonna heal, and it's gonna narrow us down to where the real issue is. Okay, so like on my back, like this whole area, the whole lumbar, and a little bit of the T section where we're stiff and hurting and all that. And I didn't know where anything, my pain and my issues came, so I started doing these things, and I noticed that everything from here to here was completely loose, and it finally just left me with a section right here that was the issue. So I was able to free everything around, and of course, I have a fusion there with screws and plates and all that. There's only so much I can do with that, right? But at least I'm able to free everything else around and loosen those muscles that are connected to those areas that are stiff. That's why the spasms happen. These are muscles and areas that don't get no movement. The muscle don't know what to do anymore. When they get a movement, they go crazy. They get stiff. So if there's a movement and they pull, I mean, this will save you from having stiffness. All the stiff, hard muscles that are creating spasms and pain and concrete, that's just horrible. Okay, now after we do that, I went back. Apologize. Okay, so that was the first thing. Second thing is going to be this. I'm going to go to one Chinese cup, like I was explaining to everyone. I'm going to grab the lotion and apply it in the sides where the muscles are. Okay, this is the spinal cord. Spinal cord is right here. I'm going to grab my lotion and I'm going to trace it here and here. Work this area real good, right? Then I'm going to grab this Chinese cup. I'm going to start it up here, create some pressure, not a lot, but some, and then I'm going to grab it and just drag it. Up and down, my friend. Woo! And grab this one, roll it down. Go back up, go back down. You do this a few times. You do 3 one side and 3 the other, and then switch. And then you go 1, 2, 3, 4, 5, 6. Whew. Can you imagine doing that in an area where it's atrophy, where it's stiff, where it's hard, where just, you know, this loosens up that area. It creates fluid, it brings blood stimulation. It's another way of stimulating a paralyzed area. Okay, you can't move yourself. This will move it for you. We're forcing blood in areas where there was no blood. We're bringing out pockets of fluid. Okay, don't you say that word, toxins. um, Pockets of fluid that have been sitting there, caught between the layers of skin because there's no movement. You know, if you don't, that skin starts getting stuck together, so it becomes hard to move. Then under that, then you got scar tissue. This sticks to the skin that's already stuck, and then under that, then you got muscles that are atrophied like concrete, and they're not moving. So you see what I'm saying? You got so many levels and layers that you need to work on, and that's why I like my Chinese scalp therapies, because they actually allow you to go to certain levels and rip that up and straight, you know, we're going to elongate the muscle, make it longer, stretch it. We're going to stretch the muscle. We're going to stimulate it. We're going to feed it fluids and vitamins. And that's to me what Chinese cup really does, because all this that I'm talking about, scientifically, you can prove everything that I have told you 100%. Everything that I have told you right now, scientifically, whether you know about Chinese cup therapies or not, if you have somebody and do this to them, and you have a scientist looking at all this, they will tell you it's common sense. Okay, now when they start getting all crazy and magical with this stuff, you know, I take a step back on that one. So here we go. No further ado. A lot of talking. That's 30 minutes of just yapping, but it had to be done. I had to explain what we were doing. At first, it's gonna be this. Then after we do that, we're going to go to a single cup, apply the lotion, work up and down, and walk you exactly, tell you what we're doing. We're going to loosen up, create mobility, bring nutrients, stimulation to areas that are paralyzed with Chinese cups. Boom, amen. Here we go. Okay, set up the mic. I'm gonna lay down there and let's get to work. Bad thing about this is like when I lay down and start doing stuff and doing this therapy, it's so relaxing. I just want to go to sleep, but don't worry, I won't fall asleep on you. All right, here we go. First things first, decency. I don't know rules and regulations of Twitch and YouTube and all these people. They got too many rules, but I understand. So we're going to cover all bases and going to cover the areas just like I would if I had a client. This is exactly what I would do if I was working with a client. You would put towels, you protect them so they're not exposed in any areas. You want people to be comfortable. If people are not comfortable when you're working on them, you're never gonna get them to release muscles, because if they're all stiff and nervous, then there's no release. Okay. Now I would put a towel back there and stuff, and it's not just so you can't see my behind, but it's because we're gonna be using lotions and stuff, and you don't want to be ruining people's stuff. So we're gonna be able to work and put lotion there because we have a protecting towel there. That's how professionals do it. So tip number one is that. Okay. So I am going to move this and set up all my cups here in this chair. I'm gonna be working out of this chair, my friends. It's gonna look funny sometimes, but that's okay. Like I said, we're live. We are live here. One second. Oh my goodness. Not gonna edit that out, okay? Here we go. So take this guy right here, and you're going to stick this tube here. Okay? So that's first step. First step is that. First step is don't break your equipment. So you're gonna grab this tube and you're going to connect it, okay? And then we're gonna start with a big cup. So I would just get it ready and have it by its side so you don't have to struggle later on. Alright, here we go. It's gonna be a towel to clean lotion and stuff. Oh, there's gonna be one step that I'm gonna do before. I'm gonna show everyone. There's gonna be a step here. We're actually gonna use this guy here. I'm gonna be using this guy real quick to loosen up first. So this is what I like to do before I start with the cups. I like to. All right. Oh man, I'm already contra already. Oh no, I already want to go to sleep. Okay, last is coming on. Officially blind as a bat now. Oh my goodness. You guys ready for this one? This is amazing. I love doing this. This is so much fun. And it feels great too. Okay. So, see how we're looking over here? Looking alright. Oh, can you guys see good? I hope you can. I hope you guys are enjoying this series. And my whole goal of me doing this, I'm not trying to get any clout or become famous or anything. I'm just trying to show people that are struggling with what I'm struggling so they can help themselves and not just sit there and wait for a miracle to happen. Anyway, so here we go. Back exposed, surgery, scar, boom. Make sure everything's cool. Okay, so primary scar, car accident, L3, L4, spinal fusion. Okay, right here, boom. Right here, second cut. That's where they took bone from my hip to rebuild my vertebrae that were exploded. Okay, so that's why I had the scar there. The scar was to build the vertebrae that are there now. So they took a bone from here and they went in there. All right, first things first. I'm gonna grab your massaging, and you're going to stimulate all around your scar, all around your injury. Don't go into the spinal cord. Oh, yes, this feels amazing. Whenever you work these things in areas where you have like no mobility or anything, it feels great. And notice how I'm just going up. Down and up. Down, up, a little to the left. Down, up, a little to the left. Down, up, down, up, down, up, down, up, down, up, down, up. And by the way, look at what I'm using here. This guy. Sorry. This guy right here. That's the one you want to use. Because he digs real deep. You see this little pointy stuff? That will make you go deep. Okay, so we went a couple times up and down in that side. Now we're going to go in this one. We're going to go up and down. Nice and slow. Up and down. Oh, and if you find like an area where it really hurts and it's really stiff, just leave it there for a minute. Oh, let that vibration do its job. There you go. So down and up, down and up, down and up. So I do this for a few reasons. Obviously, to loosen up the area where we're gonna work and warm it up, and also because sometimes you're so stiff and atrophied that you want to loosen up the muscles so you can do movements and not pull,
Because if I just start doing the Chinese cups, and if I have to reach like this, like I'm doing right now, and this is not loosened up or not warmed up, I might just get a spasm, and that would suck because we haven't even got to do anything, and then you have to like, oh no, I can't do this because I got a spasm. So that's what I'm doing right now. I'm loosening all the stuff up, so it gives me a little bit of more mobility. Oh, this feels amazing. So at no point at any time I'm going up in my spine. Now, I'm going around the sides. I'm going around the muscle. Okay, now watch this. Now, if you want to go on the spine, you can. But this is all you do. You grab this thing and you put it right there. Don't move it. Just let it sit there. Stimulate that vertebrae. Don't push down. Don't push up and down. Nothing. Just let it sit there. And then if you want to go up, lift it and put it down again. Okay? And that's it. I don't want you to do any of this or any of that on the spinal cord. Spinal cord is stimulated by just putting it like this. If you want to put it in the spinal cord, like right now, that's where my screws and my titanium and my plates are. You can do it. Just don't go in there digging for stuff that you shouldn't. Okay? Now, you want to dig and work on stuff here in the sides. This whole side's right here. Oh, yep, that feels amazing. So first step is use your massager and loosen everything up. If you have to go up here, go up here. Amazing. You can go like this too. Left and right, left and right, left and right, left and right. Always stopping before we get to the spinal cord. Okay? And you can feel the tightness on this. Oh man, it feels great. Same thing here. Left. Go right and left. Stop right before the spine. See? Not even going to the spine. It's going here inside. You can push here in the side hard. Oh, feels so good. Up and down. Down and up. Down and up. Okay? Down and up. 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 Stimulate the sides, the ribs a little bit, stuff that gets locked up when you do movement. All right. Now it's nice and warm. We loosen it up a little bit. I'm able to create movements. That's how you would gauge it. As you're working on this, if you like start getting spasms, like in some area, just shove it in there. Let it work on, okay? Once again, do not work on the spinal cord, but if you do want to stimulate your spinal cord, watch this. Put it right there. Don't push down. Not at all. The thing is literally just resting with its own weight. I'm just holding it so it doesn't fall over, okay? You're not going to manipulate up, down. You're not going to push down. No pressure whatsoever. Then you will lift it up and gently put it in the next vertebrae and just leave it there. Don't push down. Literally just having the thing resting there by itself, just stimulating. Okay, that's how you stimulate the spinal cord. If you want to go into the spinal cord, do not push up, down, left, right, or anything like that. And that's the thing, you have to be careful. I'm glad you guys saw that. If you do set it like that, make sure you put your arms in the side so when this rolls off, it just, Okay, so step number 1. We are pretty much done with this. Oh, that feels so good though. Oh, it feels amazing. All right, boom. We're done with the massage. Okay, so we warmed that area up. Now we're able to put the cups and stuff like that, and not create. See, this is why we loosen it up. So now I can reach and do movements and not have the danger of this area just pull out of me because I reached to that way. Okay, here we go. First step, like explained earlier, we're just gonna put the cups on and just let them do their thing, and then we're gonna just tear some stuff up. Alright, so boom. Doesn't matter what cup, just go from big to small, I guess. Set them up. Okay. So remember, bear with me, guys. We're live, and I'm trying to show you everything, how I would do it. So try to look at my technique. So I would just get that like that. Just identify what it is. Got the cup, got the end. Make sure that this, yeah, you might want to go up and down on the little plastic pin. Sometimes it locks up. So make sure you put the cup in there. Boom. And you put it against your skin right there. Trying to show you how to do it by yourself. Now, this part here is very important. These two things, just keep them together like this. That's all that matters. Okay, scar. Boom. Up and down. Boom. Top part of the scar. We have moved to the side. We're not in the spinal cord. Spinal cord is nice and moving. I'm going to separate it and put it close, but not too close, because this is going to create some pulling also. Top of the scar. There we go. And grab this end and go 1, 2. Okay. I just pumped it twice. This is for you to assess where it is. If you're there and it doesn't hurt, it's not pinching, it's not creating pain, then go back to the top and give it one more. That's 3, okay? I'll leave that guy in 3 pumps. Now we're gonna reach for the next one. Okay, that was 3 pumps. Remember that. We did 3 pumps. You wanna do the same amount of pumps and everything, okay? Now that we have one in there, now it's a lot easier. We're just gonna go right across the street from that one. Here's spine, here's this, up, boom, right here. Okay, here we are. Put that there, spinal cord, safe area, right in front. Hold that in, go 1, 1, 2, 3. Okay, the first one was a miss, so I really have 2, so we go 3. Okay, now it's the same tie. Now they're about the same. Okay, so just 3 pumps for now. Then you're tying them up more, okay? Just grab 1 cup at a time. Grab 1 cup at a time. Put it in the thing. Find the spinal cord. Go to the side of the spinal cord. Have a finger or 2 between these guys, because if you just put it right next to each other, the pressure of the skin, when it pulls the skin, is going to release the pressure that you have up there. So once again, away from the spinal cord. A couple fingers away from that, and 1, 2, 3. 3 pumps. Boom. Got it. Next one. Okay. Same thing. Spinal cord. Boom, boom, boom. Same distance to fingers. Not so close. We're just gonna impede the movement of the other one. Boom, 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 boom. And 1, 2, 3. Bam. Nice, 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 nice. I like the way that's feeling right there. Yep. And then one more. Let me grab one more guy. This is like the smallest guy here. Now you never want to put the cups on top of the spine. Put them around the spine. This guy, we're going to go a little bit higher here. And go 1, 2, 3. And perfect. Next guy. Woo! See, that's why you want to loosen up. That's why you want to use the massager at the beginning, to loosen up everything. If you didn't do that at the beginning, your muscles would be so tight in the back that right now we would have had a spasm for sure. But since we warmed stuff up and we used the massager, then we're able to not get locked up. But I do feel the burning in the back. So here we go. 1, 2, 3. Okay. Oh. So we have accomplished step number 1, which is putting all the Chinese cups around your injury. Okay. So now we did 3 pumps, right? And we're going to leave those 3 pumps. We're going to count, 1, 2, just leave them there for like a minute or two, okay? Maybe 3 minutes. And then you're gonna go to the bottom one, put the thing on, and make sure it's nice and tight, do one more pump. Then you go and find the next one. Oh, and unfortunately, and this is good, and unfortunately, because we tightened this one loosened up, and that's perfect. I wanted that to happen. So we go back and we go one, oh, one, two, 3, and 4. Boom. Now we got our 4. Here we got 3. That didn't shoot through. Oh, that's not in. Oh, that was in. So 4. Okay, so we got 4 pumps in the left. Woo! All right. Now, there's no way you can feel this, but I do. I can feel stretching on the whole left side of that muscle from top to bottom. I can feel actually like giving out, like it's being stretched out, and that's what we're looking for. Now go to this guy and give him one more extra. Wham! Perfect. This guy and try to give him one more extra. There you are, buddy. Oh, one extra. Perfect. Oh. And then we got this guy. I'm gonna give him one more extra. One more. Bam. Oh, that feels amazing. So, what's going on right now, other than looking creepy? What does that look like? Oh, that looks beautiful. Oh, that looks beautiful. Such a beautiful thing. Okay, so what's going on right now? I tell you what's going on right now. It feels amazing. Oh, man. I don't even want to talk. Okay, here we go. So what are we doing right now? We're bringing fluids. We're bringing blood. We're lifting. We're lifting layers of skin. We're separating fascia. We're stimulating. We're loosening a muscle. This is kind of like doing a trigger point, right? It's kind of like when you have a really tight muscle and they just like push it down to release that. That's what we're doing. We're releasing the stiffness. Oh my goodness. I'm sorry, guys. This feels so good. I don't even want to talk. So I will usually do this on the days when my back is really tight and really stiff and having a lot of spasms. And I'm not gonna lie to you guys, this hurts a little bit, but my back hurts anyway. You get used to the pain. If you've been dealing with this stuff for a long time, then you know what I'm talking about. Your pain level goes up. You know, you can manage so much more pain now. Oh man, this feels so good. So I will probably leave this on for like 10 minutes, right? So every 10 minutes, think about it. It's like, okay, you don't want to overdo the Chinese cups. You don't want to create too much pressure to the point where it hurts. Okay, right now, what I'm feeling, it feels tight, but there's no pain, right? It feels tight because it's being sucked up. There's suction. So everything's being pulled up, like really tight, right? But what I want to do is eventually, when I let go of the air, you're gonna feel everything just loosen up so much. So first we did 3 pumps to make sure they're all in place. Just remember the number of the pumps is really important. You do 3 here, you do 3 here, you do 3 there, 3 there. Oh my God, this feels so good. So you do 3, 3. We did 3 to do the initial setup. Once we figure it out, we're in the right place and we feel a little bit of tightness and stuff, then we go back and we do one more pump. So literally I only have 4 pumps in each. So 1, 4, 4, 4, 4. Okay, very important. 4, 4, 4, 4. And notice we're just treating my lumbar area. Okay, my area of issue is the lumbar. That's what this is on. Okay, so what have we done up to here? First we used the massaging machine and we loosened up the whole area. Loosen the whole area up just to warm up that area, to avoid spasms, to avoid things, because I'm doing all the work, and I don't want to get a spasm because I'm trying to use this area when it's nice and stiff. Another thing you might want to look into is some people, if this area gets too cold, they'll go into spasm. So it's okay, if you like, to put a towel on top. So pretend this is a towel right here. I would just lay the towel on top like this. Just put a towel on top like that to make you warm. If you're one of those people that get spasms when you're cold, or if it's like the winter time, because the winter time will make you more spasms. So when you do this therapy, it's very important to be warm, especially if your skin's gonna be exposed, because otherwise it's just gonna like spasm. So you can put the Chinese cups, and then you can cover them with a towel just on top like that, and then you'll feel the warmth, which is fine. Warmth is better. So I'll probably leave that on. I will literally sit here for like 10-15 minutes, okay? Maybe 20, all right? If it's not too tight, you don't want to overdo the tightness on this, okay? You want to feel where it feels nice and tight, but you don't want to feel pain. You don't want to feel discomfort. Okay, so we got 4 pumps and everything. So we got 4 pumps in this, and 15 minutes have gone by. Now, I'm going to do this real quick, and I do it just to get a little extra pull, but I don't leave it for that long. So I have 4 pumps. I'm going for a 5th, but this is not going to be a full 5th. This is a half pump. So here we go. Oof. Actually, it is a full pump. 5. Boom. And 5. So you will tighten it up a little bit after like 15 minutes. Just do 1 pump. Boom. 5. And 5. And 5. So what did we do? Oof. Yeah. Nice. So we did, first we did the cups for, first we did the loosening up with the machine. Do that for a few minutes, 2-3 minutes. Now you set up the cups, and you set them up this way. Leave the spinal cord in the middle. Oof, everything feels nice and snug. That's what you want. You want the feel of tightness right now, where if it feels like if I'm gonna move this arm right here, like these things are gonna explode out, and that's fine. Trust me. So we did the 4 pumps. We set them up in the right place. We did 3 pumps to lock them up. Then we came back and did 1 more pump and everything. That's 4. We stayed there for 15 minutes, or from 10 to 15 minutes on 4 pumps. And now I went back. I did 1 more pump for 5 of pressure. 5. And I'm going to leave that for only a minute or 2. Not that long. Don't leave it for more than 5 minutes. Don't leave it for more than 3 minutes, okay? And I'm at the point where it almost hurts, okay? It's a fine line of pain and discomfort. You want to find that very thin line. Now, if I went back with this and I did 1 more pump, that would hurt, okay? So you want to, in yourself, 3 pumps might do it for you, okay? I'm just showing you how to gauge it, okay? So with the last time I tightened it, that's 5 pumps, and I'm gonna leave that on for like a minute or 2. So a minute or 2 has gone by. Tops 3, and now I'm gonna start from the bottom one. The first one I put in. Oof. Oh, it feels amazing. It feels so good when you release them, because that air, it just, it makes you realize how loose everything is. Oh yeah, and then the cool thing is that you start taking off the ones in the bottom, and then you start feeling how tight the other ones are. Oh, 1 and 2 pulls. Oh, that feels amazing. Okay, right off the bat. Oh, I don't know if you guys heard that, but just by adjusting like this, my back just cracked. It's completely exploded right here. Why? Because we got rid of so much pressure. That feels amazing. That feels so good right now. So, you take off the cups. What do you do next? Your trusty friend Lotion, my friend. Don't put them on right away, okay? Once you take off the cups, put a little bit of lotion in your hand, and watch how I do all this. I mean, learn from my trickster ways. I'm just kidding. Learn all the little tricks I'm showing you here. So I'm gonna grab some lotion here, and you're gonna grab a little bit of lotion and go like this and like this. And put in both of your hands and literally just run up and down. Up and down, up and down. Oh, down and up. You're gonna start feeling, you're stretching. Right here, you're stretching your spine. You're stretching all the muscles. It actually feels amazing. Every time that I'm going down like this, at the end there's a complete pop, 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 pop. The release in the spine is amazing when I do this. God, sorry guys, bear with me. This feels so good. So I know you can't hear it, and you have to take my word for it. But I wish I had a mic. Let's see if I can do this another day. Try to put a mic on my back. See if you can literally hear the release. And so once again, put a little bit of lotion here, 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 here. Here, 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 here. Grab both hands and literally just down and up, down and up. Just work the whole area up and down, and you can hear the release. The longer that you leave it on, of course, it's gonna work really good. But if you plan to leave the Chinese cups on for a long time, don't go super tight, okay? Just gradually, as you have them on, start making them tighter. Don't just put them on and go 5 pumps. Don't go full potato. don't put on the cups and just do like 10 pumps right off the bat. That is dumb, okay? You want to place the cup, do 2 to 3 pumps to set everything up. You want to set them all up. Once you got those 2 and 3 pumps that are nice and stiff, you put them all there. And then once you put them all there and you figure it out, that's where you want them, then you go back and do a 4th or a 5th pump. Trust me, you don't need more than 5. You want to feel nice and tight. That whole area, you want to feel like somebody's just holding you really tight and really, 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 really strong and really tight. You leave them there for from 10 to 15 minutes. Or if it starts hurting, you take it off. But if it hurts, you're doing it wrong. If any of this hurts, you're doing it wrong. Have you heard me scream? Am I in pain? No. Okay. So we did that. Oh God, this feels amazing. I love this. Put that stuff on. Okay, I like to go over where the cups are, and trust me, just run your hands down your back. You'll be able to feel the dents. Okay, perfect. Amazing. All right. So that was step number 1. Now, we are going to go to step number 2. So, yeah, probably, let's try the biggest cup. Try with the biggest cup you got first. And if not, try the second biggest. Put all the stuff here. Now it's a little bit tricky because your hands have lotion, so everything's a little bit slippery. So try not to drop your equipment, because that's when everything goes bad. So I'll grab my towel here, wipe off my hands a little bit because I just applied all the lotion. Remember, I have lotion in my back. I got a nice little thick lotion layer there. Okay. Oh my goodness, the release on this stuff is just ridiculous. My back is nice and soft, and when I was starting to do all these movements, it was nice and tight, and now I feel myself being able to stretch without having that constriction there. Okay, now we have put the lotion up and down. Now we're gonna grab the biggest cup. And you can either put her in the top or the bottom. But remember, not in the spine, around the spine. Okay? Left side, right side, left side. Grab this guy. Now this is a little bit rough, but if you can't get to this point yet, don't worry. Skip it. And just do the first one. And then eventually you'll work yourself to this. But if you can do this right away, do it. Okay. Set it up. Go. 1 pump, 2 pumps. Just 2. I just did 2. Okay? Now, I'm going to grab it with my hand with 2 pumps only. Woo! Ready? Oh, boy. Oh boy, hold on. I have to release a little bit more. That is too tight. 2 pumps was too tight, guys. So I'm gonna have to go to 1 pump. 1 pump, 1 pump, 1 pump. Ready? And 1. Oh yeah. There you go. You take 1 pump and you start moving the cup up and down. Up. Move it down. Move it up. See? It's stuck in there. Down. It's stuck. I can't get it off. This is not for the faint of heart. This might hurt a little bit, but right here, oh my goodness, we're ripping tissues. We're creating mobility by forcing mobility there. Oh my goodness. Make sure you got lots of lotion in there so this thing can slide, you know? Oh my goodness. Look. Ready? See? It was tight. Alright, so went up and down a few times there. I'm gonna grab a little bit more lotion. Just make sure you grab lotion. Don't grab oil. Such a mess with the oil. Okay, now we're gonna go to this side and do both. Go to the side, work it up and down like that. Okay. It's a little messy, but that's why you want to have your towel in hand. Make sure, doing all this work yourself. Usually somebody else does it for you, but you have nobody else. All you have is your $12 Chinese cup therapy kit and yourself. And you can't pay hundreds of dollars for somebody to do Chinese cup therapy. You can do it yourself. Okay. Boom. Here we go. Spinal cord. Muscle area. Put it on. And 1 pump. Bam. 1 pump. Down and up. Down and up. Down and up. Whew. It's a little rough. If you can't stand it, don't do it. Or if it's a little too hard, then just put some lotion in there. But see, that's nice and tight. You go down and up. Around the spinal cord. Not in the spinal cord at all. Working those muscles here. They're stiff and hard. Look, that thing is just suction in there big time. Up and down. Up and down. Up and down. Up and down. And down, up and down, up and down. And look how much I have to pull for it to come off. Ready? So that's pretty much the second step of you would do. So first you put on the Chinese cups, how we did at the beginning. Just set them in one place. Make sure you get some of that lotion in there. Just make sure you got enough lotion, man. So otherwise it just burns real bad. You don't want to burn your skin. The whole point of this is being able to glide. There you go. Got 1 pump. Might take 2. This one was 1.5. Down and up. Down and up. Down and up. All around the spinal cord. I'm not in the spinal cord. I'm working my L3, L4. I'm pretty much working my whole lumbar area. I noticed that if I just work the whole area, it's better anyway. Up and down. Whew. Down and up. Down. And look at that thing. It's in there good. So 1 pump, 1.5 is good. And look at that. We're just creating mobility. We're tearing up scar tissue. We're bringing fluids. We're telling blood where to go. We're bringing out stagnant stuff that's stuck in there. Do not say toxins. Up and down. So guys, this is the first therapy with the Chinese cups that we're gonna do. So this is day number 3 in your whole week of therapy. So you watch show number 2, do the stretches. Oh my god, I don't even want to move from here. How's my back look? Oh yeah, that's looking real pretty. Look at that beauty. Look at that beauty. That looks amazing. But I'm telling you, if you have scar tissue, if you have muscles that are atrophy, that are hard as concrete, if you're having spasms, if you're reaching for stuff and you're getting locked into a spasm, stuff like this thing is what's going to release all that. We literally went in there and grabbed that area and say moved. Especially when I grabbed the cup and I start going up and down, guys, that hurts a lot. But it's just grabbing all the layers of skin and just pulling it. It's bringing blood, it's pumping fluids, it's feeding the muscles, the nerves, it's feeding everything, you know. It's literally grabbing those areas where there's no movement and creating some movement. Tearing up scar tissue. I mean, I can't. That's my major thing with the Chinese cups. Chinese cups allow you to go in deep. Get some good flow, loosen up muscles. Like we just stretched the whole area when we're going like this. My whole back is so loose right now. It is ridiculous how loose it is now. I'm still stiff, but not as stiff as when we started this video. That's for sure. You know? Oh my goodness. So, excuse me. That is, yeah, and then you get to have those cool things there for a while. They go away after like 3 days. Who cares? But I will do that. If you want to do Chinese cup a lot during the week, I would just do it like twice a week. Just do it like on Monday and Friday, because you want to give some days between. Maybe like Monday and Thursday, something like that, because you do want to give some days between for all the stuff, all that blood to be sucked down into the body again and to be gone from there, you know. Because I mean, you are left with some red spots with blood and stuff like that. You want your body to break that down and all that. Sorry guys, arranging the camera here. This video is a little bit longer, but you guys saw that we just did some major work, and I also explained why we're doing this. It's not just do it because I say so. There's a purpose on this. So like I said, this is the first video with Chinese cup therapies, but there's more. There's so much more that you can do with the Chinese cups, and we'll be doing it also over and over again. I'm gonna leave this guy here because he's got lotion. Make sure I remember to watch that guy. These other guys here are cool. So, recapping this whole thing. First thing to do, grab this bad boy. And grab this guy and see those teeth? Use that setting. Because you can dig in and you can rip and, just stretch, and it goes in deeper. If you grab the flat one doesn't go in as deep, but this guy right here, look at that, it almost looks like a torturing device. That's the one that I like. This goes deep. So use this first to loosen up the area, like I did. Exactly how I did. Here we go. One more time. Pen. It's my spine. Okay. Grab the massager. Grab the massager, and you're gonna work all this up and down, up and down. Here's the spinal cord. Up and down, up and down. left and right, left and right, left and right. Stopping before you get to the spinal cord canal. Okay, see how I'm doing it? And then up again. Boom, 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 boom. Go to the other side, same thing. Left and right, left and right, left and right, and then up again, left and right, left and right. I mean, I'm literally showing you. Here's the spinal cord. Up and down, up and down, up and down, up and down, up and down. Okay? So first step is this. Do that for like 5 minutes. It feels really good. The more little things that you do, like, oh god, my back feels amazing. I love doing this. Okay, so now I really hope you get as much benefit as I do from doing this because it feels amazing. Oh god, I feel like I'm ready to just like start lifting, doing crazy stuff like that. But gotta be careful. All right, so now the cups. Once again, here's the spine. Set the first cup up there. Oh, that one's the greasy one. This is the greasy one. Sorry, wipe my hands off. Oh man, I'm gonna be working. I'm gonna also show you how to do this whole here in front. This is like my issue area, and I use this. Woo, feels amazing. Okay, so first you're gonna use the cups, and you're going to go apply them like that. Put this guy here. Find the equivalent, same line. Put the guy right there, away from the spinal cord. Then you go to the next one with a little bit of room between, like this. Okay, see that? See how much room I have between everything like that? And here, I want you to do that also when you put it on yourself. Okay, here's my whole lumbar area of thoracic or whatever. It's a little bit more complicated to use Chinese cups on the neck area, but I know how to do it and I will show you. Very tricky, more complicated. You have to be careful because there's a lot of stuff that comes down here, major arteries and stuff. You don't want to mess around with any arteries. Do not put this anywhere where you have like a fat vein or something like that. No, okay? Be careful when you place these things, okay? So not in top of nerves too, because you put it right on top of a wrong nerve and pull it on, you might inflammate that nerve. We'll go over that anyway. So spinal cord in the middle, right? Spinal cord's here. Chinese cup, Chinese cup, Chinese cup, Chinese cup. Boom, boom. Do 3 pumps first. 1, 2, 3. Secure. 1, 2, 3. As you put them on. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. Right? Okay. Now we have them there, and it feels nice and tight. Leave them there for a few minutes, and we're to the point where it's kind of not feeling so tight anymore. Then you go back and you do one more. So 3 there. Boom. 4. You go back here. That'll be boom. 5. 4. Here, boom, 4. Boom, 4. Boom, 4. Boom, 4. Okay, now sit there for another 5 to 6 minutes and you start to feel that tightness, loosen it up. When you feel that other loose, then give it one more pump. Boom, I go to 5, okay? Just when you say one pump's like this. Boom, 1. Just go full all the way. Make sure the sides are here nice and snug in there. Boom. That's 5. That's 5, 5, 5, and 5. Okay? Now leave it there and sit there for 10 minutes. 10 minutes. Okay? Oh no, I'm sorry. With the sorry about that. With the 5th pump, you only want to do a few minutes. Okay? So if it feels super tight, then only do it for like 2 or 3 minutes, okay? So up to 4 pumps, you can do 10, 15 minutes. 5 pumps starts to get really tight. If it's really, really, really tight, you want to leave it there for a long bunch of time. It's not going to do anything. It actually can create some issues. If you're not careful, you put too much pressure there, you can burst some blood vessels and stuff like that. So you're looking for the pump to be tight. That whole area is going to be tight, but no pain. Okay, if you put it on and you feel like burning and discomfort, too tight. Okay, you don't want to feel that whole thing with blood up like that. We're not doing wet cupping. Forget about I said that because you're just gonna get confused. Wet cupping is not what we're doing.
Okay, so put those things on like that, leave them for whatever time. You tighten it up. Boom, start releasing them, and release them like this order. Tops first, or this is how you want to release it, because it makes you feel more of the release, and it's more dramatic and it's better. Uh, Boom. Okay, I've released them, right? Okay, we released them. Then we grab some lotion. Okay, grab the lotion and we apply the lotion in the sides of the spine. Here's the spine. We went up, down, put the lotion. And now, when I was working the lotion, when I was putting it on, I was also stretching. I was grabbing my hips and my back, and I was pushing like this, and I could literally feel the tension from here going pop, 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 pop. So that means it is working. It was releasing all the stress. And I took a breath in, and my back went pop. So that means more release, okay? So you put the lotion here, here, go up and down, try to work it together at the same time. Grab your hands, grab your back like this, and bring it down like that. This is a good way to stretch it your back. Push, 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 push down. When you get to the end, do a little left, right, and you'll create a little crack, and it will go pop, and will release that. Okay? So grab your hands like this, if you can. Go down, down to the hip, and then wiggle it. Oh, you can hear the release. You want to get the release out. Okay, so lotion, lotion, push down. Then you grab one guy with the lotion on. Make sure you get a lot of lotion, because you want to glide this guy. Put this guy here. You're literally going to grab this guy here and do one pump, okay? Just do one pump where it's nice and tight in there, snuggle. And now you grab yourself and you go up and down, up and down, up and down, up and down. You guys saw me. You guys saw me doing it. Up and down, 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 up and down. Same thing. Repeat a few times around the spine. Do not go too close to the spinal cord. Do not go into the spinal canal. You're looking for those two long pieces of tissue muscle that are running down here. Okay? This is what you want to work. Look how beautiful that looks. Chinese cup, baby. So that's how I use Chinese cups. Okay? Everything that I have said here, 100% proof. There's nothing that I have said here that's magical or there's not understanding. Everything has been explained, and it has a reason. Not just doing stuff and just saying releasing toxins. No. We're working, we're losing up muscles that are stuck in atrophy. Guys, it's been an hour and 23 minutes. I gotta cut this. So please catch the live stream, Twitch TV, www.twitch.tv, disable everything. If you put www.theabledisable.com, it will shoot you into my website. When you go into my website, you're going to see a few windows. One of them says like Twitter, another one says Facebook, another one says Twitch. Go and click on that, and that will shoot you into all my stuff, into all my social media, into everything that you need done. So when you're looking for my stuff, go to www.theabledisable.com. Okay, that's where you can find all my social media. That's where you can get a hold of me. I want you guys to watch the live stream so we can apply all these things into you if you were injured. So I want you to write, oh, I got it, T6, T7, I'm injured. What should I do? So in the live stream, I will show you. I will go into Google. First, we'll identify what nerves come out of that vertebrae, where the canal is, what limbs you run into, and then we'll start treating everything like that. Alright, guys, that's enough of me talking. I just want to say thank you for watching Pro Gamer. Keep your head up, my brother. Keep doing everything. You're going to have results, man. I mean, I love your positive attitude. You're a warrior. I salute you. I know what you're going through, and you, my friend, are not alone. I've been there, and a lot of people are watching this have been going through the same. So we're all a team. We're all the family, the able disabled family. Yes, you also are the able disabled. I'm the able disabled. You're the able disabled. We're not giving up, okay? So I love you all. Much love, respect. Please share, comment, whatever. Love you guys. Never give up. Keep fighting the fight. And hopefully this video has been helpful. Please leave me any questions, anything. Just talk to me so I can help you, okay? I want to help you like I wish somebody will help me. Have a good day. Love you all. Respect everyone.